So childhood and adolescence is a really challenging time. We know this, and from a nutrition point of view, this is due to high nutrient requirements and often less than adequate nutrient intakes, particularly into the teenage years. Of late, COVID-19 and the cost of living crisis has risked exacerbating this problem. And so in this presentation, I'll be briefly reviewing the health status in children and young people in Northern Ireland and the UK as well, and try to understand the implications of the cost of living crisis on schools and pupils. So a quick introduction on health status in children and young people. So this is UK-wide data for 11 to 18-year-olds. So only 12%, unfortunately, are getting their 5 a day. Only 4% are meeting fiber requirements. And there's only 2 grams of oily fish being eaten per day as average. And that's about 10% of the recommendations in the Eat Well guide. So overall, we know then that the dietary quality in UK children and adolescents is poor, and this suggests that childhood and adolescence is a key time to make targeted changes to nutrition. But with current difficulties with cost of living and, as I say, coming out of COVID, this is more difficult than ever. So here's some more information from Northern Ireland around overweight, obesity and physical activity. So this is from 2021, and we know that COVID has again, exacerbated some of these issues with overweight or obesity rates due to people being inside during lockdown and being more sedentary on average. So these figures are probably slightly higher at the moment, but this is the latest figures for Northern Ireland. Around a quarter, 25% of children aged 2 to 15 were either overweight or obese in 2020 to 2021. In the graph in the bottom left here, you can see the split by boys and girls. So it's quite similar, although girls at this age range are slightly more likely to be obese than boys. On the right here, you can see a report card. This is produced for Ireland and Northern Ireland together, although some of the metrics are reported separately. And what this does is it looks at physical activity of children in Northern Ireland in various different aspects and different settings. So there's an overall rating for physical activity, there's active play, sedentary behaviors, schools, so whether schools are set up to provide physical activity, physical education, and then things like government policy as well. And it's given a grade from A to F, and you can see on the right, the 2022, that there are scores for sort of majority of children, and then also a score for those with disabilities as well. So some of those may be quite different. And just to kind of put this in perspective, a C grade essentially denotes that around 50% of children are meeting the targets that are set for that category. So anything below that's less than 50%, and around 95 to 99% would get an A grade. So in many areas, there's still more to be done. However, the 2022 scores overall are somewhat better than the 2014 and 2016 scores. So some of those things are moving in the right direction, at least, although, of course, COVID's made that difficult. So moving on to poverty and food insecurity. So there are disparities in different areas of Northern Ireland. You can see on the right here the child poverty rate. The darker purple is higher rates of child poverty, and this is also correlated with other poor health outcomes. So, for example, on the right, the map is for life expectancy as well, and you can see that for some of these areas that there's significant crossover there. The graph in the bottom right, this also shows that there is a growing gap in the poverty rate of those people in ethnic minority backgrounds in Northern Ireland. And there's a concerning increase in that line, the dotted line along the top there. So that's something to be aware of as well. And then finally, the figure on the bottom left, this is around changing in eating habits. And basically what this shows is that at very low food security, financial pressures have a very, very high chance to change someone's eating habits in a negative way. And so that's brings the link between poverty and food insecurity together. And of course, with the cost of living crisis, the chances are that financial pressures are much higher for most of the population in Northern Ireland. So the cost of living then for children and families. So statistically, at the moment in the UK, around 8 in every 30 children in a classroom are technically in poverty. An estimated 500,000 more children will be pushed into poverty if wages don't increase with the rate of inflation, as that's been rising. Over a quarter of parents in the last year said that their child's mental health had worsened due to the situation. And we know that this can affect other aspects of their health, such as food choice, willingness to exercise as well. So all of these issues compound each other. And then there's a quote here from Courtney Sutton from Action for Children, describing one family situation. And unfortunately, we've seen many sad stories like this. So they're working with a family who are on low income, not entitled to public funding, and renting a one-bedroom flat, costing a lot. And they've relied on the father's income, but the mother's had to return to work just 3 months after having her baby, due to the financial pressures they've been under. And without charitable support, they would have struggled for their basic foods and essentials. And Barnardo's as well wrote an open letter around the situation in Northern Ireland last year, saying that they were aware of heartbreaking stories of people skipping meals, turning off their heating, sitting in the dark with no electricity, and even making their own sanitary products because they cannot get by any other way. Research also predicts a fuel poverty rate of over 70% in Northern Ireland, but at the start of this year, meaning that over 1.4 million people in Northern Ireland are going to be struggling to afford their energy bill. So clearly the impact of this is very high. And of course, this doesn't just affect homes, it also affects schools. So as I'm sure you know, the cost of energy bills and resources for schools have been rising dramatically due to inflation and other cost pressures. There's evidence from survey data of reduced uptake of after school clubs, increase in people skipping meals, increased absences, things like printing bans where schools have had to cut back on costs wherever they can, reductions in clothing donations, and many, many more. In some schools, energy bills have as much as trebled as well. And the National Association of Head Teachers said that 9 in 10 schools will fall into deficit by the next academic year. So a lot of the data at the moment is survey data and reports in news articles, and those are valuable. But now there is research beginning to come out on cost of living and also from the end of the impact of COVID. So there's mounting evidence now of increased poverty in UK children in hospitals. And as we know, those living in poverty are more likely to have chronic long-term conditions and be in hospitalized more often. The Lancet has published an editorial on the cost of living for UK young people. And again, children and young people living in poverty are 72% more likely to be diagnosed with long-term illness. And we know that 90% of the UK has seen a rise in living costs. And so, of course, that's going to be pushing more young people into that bracket. Ulster University published this in May 2022, saying that almost a quarter have turned heating down or off despite houses being cold, and over a quarter of those in their research had insufficient funds to cover an unexpected but necessary £500 bill. So again, just showing the scope of the crisis. So food insecurity in children then. So we've got some headlines here. 1 in 10 children currently living in food insecurity. Now, bear in mind, this is from August 2021. So again, this is mainly from COVID impact, but with the subsequent cost of living crisis, this could even be worse than this at the moment. And the Trussell Trust reported a 75% increase in food parcels provided in 2020 and 2021. So these graphs, so this is actually data for England, but I couldn't find an equivalent for Northern Ireland, but I think this is really useful to illustrate the effect that this is having on children themselves. So this was a survey from the Food Foundation of 1,000 children about various aspects of costs and food. And you can see here on the bottom, nearly a third of children have said that they had to share food with friends because their friends didn't have enough food to eat at lunchtime. And that almost half say that they're deeply upset that other pupils in their school don't have enough to eat at school. You can also see as well in the top right that over the summer holidays, 17% said that they or their family had to visit a food bank to get food as well. So free school meals. So in England, young pupils do get free school meals for 3 years. In Scotland, this has recently been extended to all pupils P1 through 5. And of course, you've probably seen that the Mayor of London, Steve Khan, recently announced free school meals for all primary children in London for 1 year. And the National Education Union has warned that meal provision in Northern Ireland is falling behind the other countries in the UK. And they estimate that to provide school dinners daily for 3 primary age children for a month is an extra outgoing of £156 a month. And also that the rising cost of food and fuel is affecting all families, irrespective of income. And so many who may not qualify for free school meals may not be able to eat at lunchtime. And there's significant data from surveys and from anecdotal evidence that that is happening. So just a word on the school food standards. So these are currently being reviewed. It was hoped that they would launch in 2022, but they're still under review at the moment. However, the original standards still do contain valuable advice around the nutritional quality of school meal provision. And then there's the essential guide here as well, which contains guidance around establishing whole school food policies, breakfast clubs, water provision, and also things like dining experience. So these are still really useful documents to bear in mind to evaluate the food environment in your school. So hunger and learning. So hunger is associated with poorer cognition and learning, mental health concerns, behavioral issues, but also with higher risk of chronic disease, higher risk of overweight and obesity. The table on the right shows many of the findings associated with food insecurity and hunger over a longer period of time. But it's not just over these long periods of time, it's also over a short period of time. If a child comes to school hungry, there is a decrease in alertness and therefore a decrease in their attention. Their working memory capacity is limited by a lack of energy, and may be depleted by attention to discomfort. And so therefore, this can also affect their long-term memory as well. And we know that financial inequality and attainment are related as well. So research has demonstrated lower attainment for children from disadvantaged households. You can see here on the graph, this is done by free school meal eligibility, but you can see that the gap in attainment widens as well as age increases. And then we have some more survey data. Over 3/4 of educators stated their students had demonstrated fatigue or poor concentration. More than half said their students had experienced hunger or ill health. And another thing to bear in mind as well, that many pupils may experience bullying due to their family's financial circumstances. So this is data from the Department for Education. So this also shows lower attainment for certain ethnicities, as you can see on the graph here. And this is also lower than average across the board for those who are free school meal eligible. And another thing to note here, though, is that boys who are the purple dots, the dark purple dots are free school meal eligible boys. The light are not free school meal eligible. They are also shown to be performing worse on average than girls. So free school meal eligible girls performing around the same as not free school meal eligible boys. So this was something that we looked at for our Scottish conference, but we've included it here because we think it's a really useful document. So due to growing concerns about poverty in Scotland, exacerbated by COVID, this toolkit was designed by Child Poverty Action Group in Scotland. And what it allows is to create an action plan to understand the costs of your school day and how to try and deal with those and make sure that that teachers, leadership and pupils are kind of aware of those and getting the best out of their school day. So there is a 5-step program do the groundwork, involve the community, identify the actions from those first two steps, put those actions in place, and then revisit your action plan. So we think this is a really, really useful document to have a look at. So in conclusion, so we know that we face stark challenges related to obesity, outcomes, and other facets of health. Around 20% of children leave primary school obese, and we also know that nutritional status in adolescents, teenagers is poor. And due to the continuing cost of living crisis, these issues are likely to be exacerbated. One thing that's worth bearing in mind is that much of the data here is from 2021 or earlier, so it may relate to COVID, but we don't really yet know the full extent of the cost of living crisis in a data sense, because that data is still being gathered. And then just quickly before I finish up, so there's some useful additional resources here, and we'll send the presentations around so you've got all of the links. This screenshot here is from the Children's Food Policy Library, and this is really useful because it is a guide about campaigns and legislation over time that affects food policy in schools. So you've got things like free school meals in there, school food education, welfare, healthy start schemes, fruit and vegetable schemes. All of the information about those things is on there as well. So that's a really useful kind of one-stop shop to check the legislation that might be affecting you. Education Authority Northern Ireland has also published school improvement and self-evaluation for school governors. This isn't specific to food, but it's really useful in terms of kind of setting out that whole school policy and setting the standards. And then DfE, of course, have published the nutritional standards guidance, which I talked about earlier, and this is due to be updated, and hopefully that will be done soon. But as I said, it's still a really useful document as it is as well.